Hello, everyone. Thank you for joining us here at Saebo. I'm going to give the attendees just a few more minutes to come in, and then we'll get started. All righty, we're going to go ahead and get started. So my name is Dr. Scott Thompson. I'm a doctor of occupational therapy, but also the director of clinical services here at Saebo. And today I wanted to tell you about the SaeboGlove. It's an amazing product that instantaneously can change someone's life. So today we're going to talk about the importance of using your limb and having your hand engaged for your recovery, the features of the SaeboGlove, how the SaeboGlove can improve a therapy home exercise program, how the user or the clinician can regain the client's independence. I'll give you several video examples of the SaeboGlove in action, and then also just a real brief touch on research so that I don't bore you. So one of the biggest things as a clinician is I want to maximize my treatment time when I am with my client. You know, we get 30 minutes, 45 minutes, an hour, if you're lucky, an hour and a half in some random settings or inpatient settings. But what I want to do is make sure that they are getting the best treatment and doing the most that they possibly can when I'm there working with them underneath my supervision and using my clinical knowledge. So if you look at these statistics, this is research that shows what really occurs in a lot of settings for recovery or rehab recovery. So for example, the research on the left says that in the first 14 days following a stroke, when someone's in inpatient recovery, this research showed that someone used their affected limb, whether it's hemiparesis or it was flaccid, or maybe they just had a little bit of sensory loss. Nonetheless, out of 9 hours, they only used that arm 38 minutes. That's 7% of the time. That is insanely a small amount, especially if in that acute phase when somebody just had a stroke. In the middle, you'll see research that says that on an average therapy session, whether it's 45 minutes or 60 minutes, a client in rehab only does 23 to 32 repetitions per session. So imagine if you're completely able-bodied and you're going to the gym. If you only did 23 repetitions, do you really think that you're going to get strong really quickly? No. In fact, that's 23 repetitions in 45 minutes, that's 1 repetition every 2 minutes. That, as a clinician, really irks me. If that is what the research says, and that's what people are getting, no wonder stroke survivors have such a hard time recovering. And then on the right, we have another one that says in that subacute rehab phase, so once they've sort of left the inpatient facility and maybe they're in a skilled nursing facility, or maybe they're at home with home health, or if they're lucky, they have that outpatient in-home service. On average, they use their arm for 4 minutes of a session doing activity-related arm training. And what the gold standard of clinical care is supposed to be is that we focus on function, function, function. Make sure that you're using that limb, doing things you want to do so that your body and your mind connect and your recovery is exponentially faster. But unfortunately, in 2015, this says that we only did it for about 4 minutes out of a 45-minute session. Man, we got to step it up. So Saebo, knowing those statistics and being founded by occupational therapists and supported, of course, by tons of rehab around the world, we continually try to put out evidence-based products that are going to help people throughout the continuum of care. So whether you just had your stroke and they just put you in a hospital bed 5 minutes ago, all the way to people that are 23 years post-stroke, we have devices that can help you on that continuum and you're on the road to recovery. So if you look in your top right corner, you're going to see the SaeboGlove. That's what we're talking about today. Meant to be for people with minimal to no tone in their hand that really need help extending their fingers so that they can grasp and release and functionally use their hand. Right below it is our flagship device, the Saebo Flex and the Saebo Reach. When you add in the upper arm component, that is designed for people with moderate to severe spasticity and gets them working in like 20 minutes or less once you get it on there. Their hand, we had someone the other day that was 10 years post-stroke and hadn't used their hand in 10 years, and we put that device on, and all of a sudden he's grasping and releasing. And like the first 5 minutes did 20, 30 grasp and release. It was amazing. So we already beat that research from the last slide. You got the Saebo Stretch, which is a dynamic resting hand splint that allows the fingers to curl when somebody sneezes or coughs or the tone kicks in, but then helps them push their fingers back into a safe resting position so that we don't get soft tissue shortening or contractures or those really bad deformities of the fingers like boutonniere deformities or swan neck or anything like that. We have the SaeboStim Micro. I did a webinar on that just a little bit ago, and that is our sensory electrical stimulation, focusing on the sensory motor cortex, another big component that's missing in rehab and the road to recovery. We have our SaeboStim Go right here. This is our newest product, and that is a wireless wearable eStim device that is minimal on the cost, super user-friendly, has one program, you turn it on, you turn it up, you're done. People are loving this. Physiatrists, clients, clinicians, executives of hospitals are all excited about it. We are too. You got the Saebo Mirror Box. As tried and true, there's tons of research that supports mirror box therapy and shows that if you add it to whatever you're doing, unless you're doing nothing, and even if you were doing nothing, the use of the mirror box lights up the brain, gets it excited, and exponentially helps your recovery of an affected limb. We have our out of the shoe AFO right here called the Saebo Step. That's our most popular product, and people just love it all around the world. I love using it. Then we have all of our capital equipment here. For anybody that is in clinics or clinicians, this is stuff that you'll find if you go to the clinic and use it. So what is the SaeboGlove? The SaeboGlove is a cutting-edge, low-profile glove that you can see there on the left that helps a client with either neurological or orthopedic injuries incorporate their hand functionally in therapy and at home. And again, like I said before, the whole focus is supposed to be function. So you put this glove on, and now you have the ability to functionally engage with your world rather than struggle to try to pick up an object or open a cabinet or comb your hair. This helps you use your hand. And then the proprietary extension system or the tensioner system that was developed with this allows you to customize the glove and helps you extend all of your fingers and your thumb following grasp. So a lot of times when people are recovering from stroke or they have some spasticity, or I shouldn't even say stroke, when you have a neurological orthopedic injury, especially needing this glove, you're able to possibly close your hand around something, but not open your hand and let it go. So it's great if you can grab something, but then you might be carrying it around with you for a while or until it falls out of your hand, or you have to rake it on the side of a table, etc. And it's very frustrating, according to all the clients that I've worked with that have this issue. And by adding in functional grasp, you are now going to be training the grasp and release combination, allowing your brain to pick up on the motor planning and the motor performance, and those are sort of technical terms, but in the sense you're improving through repetition, and then it leads to your independence. And that's what everybody wants. We want to be independent. We're humans. We're stubborn because that's how we were built. We want to be able to not ask for help. We want to be able to do things for ourselves. And as a clinician, that is what I strive for. Independence, independence, functional independence. So who can benefit from this? If you're a client on this webinar, or if you're a clinician that have clients, you probably have people that have the diagnosis of stroke or any type of brain injury, incomplete or non-incomplete spinal cord injuries. You have multiple sclerosis, Guillain-Barré syndrome, brachial plexus injuries, radial nerve palsy, general just finger extensor weakness from lack of strength or use. I've seen that with people with arthritis. It hurts to use their hand, so then they have the weakness that comes because they don't use their hand. And all of a sudden now their hand really can't grasp and release things. So why would you use the SaeboGlove? So I talked about it a little bit earlier, but essentially if you have a neurologic or an orthopedic client, or you are that client, and the hand is involved, but you can't really use it functionally at home, you're going to want to get this device. The SaeboGlove is meant to be worn throughout the day to help you do the task that you need. And if you need a break with it, all you do is you take it off, you put it on the side, let your hand rest, let your arm rest, and then when you're ready to get up and going again, put it back on, keep going. It helps you increase your motor control, which is exactly how you function with the world. It increases the strength in the extensors and the flexors of your hand, your elbow, your shoulder. And as you're increasing strength, you also increase range of motion in all the joints of your upper extremity. You also increase your function. Again, function, function, function. We want independence and function. And by using this device and learning how to function with it, and then increasing the motor performance and control and the strength and range of motion, then you're also going to see improvements when you're not wearing the SaeboGlove. It helps you on that road to being independent and not using the SaeboGlove eventually. It also allows acute clients to incorporate their hand immediately. So like I was saying, this helps you from, you just got into a hospital bed 30 minutes ago and you can barely move your hand. You could put this on and start functioning while you're in the hospital bed. You could be working on grasp and release or movement or opposition where you touch your thumb to different fingertips. You could be doing those things while you're in the acute phase of your recovery. And then on top of that, you can combine it with electrical stimulation to help sort of boost the muscle contraction and your ability to perform the functional tasks that you need. And it's more affordable option for flaccid clients, so people who have no movement of their hand whatsoever. So how does it work? Here's a great example of just someone opening and closing their hand. That's what it looks like when you have it on, and that's how it functions. But to really understand it, I need to give a little bit of an anatomy lesson. So I'm talking about the anatomy if for non-medical personnel on this webinar. This will be maybe a little learning point. Also for the medical personnel on here, it'll help you understand fully how this actually works with the anatomy of your hand. So here is a picture of the bones of your hand. On the left is the anterior view or the palm of your hand, and on the right is the posterior view or the back of the hand. And what I really want you to focus on is the area right here. Your proximal phalange, your middle phalange, your distal phalange. These are your fingers. Everything else right here, this is all covered in skin. This is your palm. This is your thumb. But all of these little phalanges are how we bend our fingers, or are the bones, and these little joints in between them are how we bend our fingers. But unfortunately, sometimes we need assistance to do that. So if you look now at the muscles of your hand, this is what it looks like if we, and maybe this is a crude thought, but if we peeled back the skin and exposed what was underneath, this is what it looks like. Look, you have 6 different tendons that are going towards your fingers. But what a lot of non-medical people don't realize is that most of the muscles that control your fingers in your hand are not these little ones in here. They're all outside your hand. You can see here, this is the palm. You can see all of these flexors come, or all these tendons, I mean, from your flexors that are going into the palm of your hand and up to those bones that I was talking about here. So here's a picture of the muscles of your forearm. Here's your elbow. And these are muscles, these are the deep muscles, but it's just showing you an example of how many muscles are all located outside of your hand that make your fingers actually move. They're up here, and there's your tendon that goes all the way down and then to the tip of your finger right there. Now I wanted to include the picture of the carpal tunnel because part of this SaeboGlove, I'm going to talk about the features in a minute, but the splint is very important for this part. Because if you look, everybody has heard of carpal, or almost everybody has heard of carpal tunnel syndrome, right? It can cause radiating pain, stiffness, tenderness. You can't do a lot of grasp and release. Well, here's why. Here are all of the flexor tendons, the ones that I just pointed out right here, going into your hand. Here they are, crowded right in this tiny little space. And it's included with the median nerve. So imagine, oh, let me mention one more thing. If you look at all the extensor tendons, you can see they're all spread out and all laying back here in the fascia and the skin on the back of your hand. And if you can imagine taking your hand and then pulling your wrist downward, or what we call flexing it, you'll see that this area, if we could actually do a radiograph of it, oops, it shrinks, and then all of these things get pushed together. All of these extensor tendons get smashed in this little space here and spread out, and the function of our hand doesn't work. So this leads me into talking about the features of the SaeboGlove, because the splint helps with this. So here's the SaeboGlove. Here's the splint that I'm talking about. It's a spiral splint that wraps around your wrist and allows you to easily don this product. You have a forearm strap and you have a hand strap that holds it in place on your forearm and on your hand. And then you have non-slip surfaces on your fingertips to help you with grasp, and also all on the inside of this glove. Now, a lot of people, when they look at a picture, don't realize that this is 2 separate pieces that come together as one product. So this allows the SaeboGlove to be washable. This liner, this glove liner that you see here with the blue and the black and the webbing, that actually is held in place by very, very, very strong Velcro, but you can separate it from the wrist splint and then wash it in case it ever gets dirty or your hand gets sweaty from exercise or whatever. You also have all of these tensioners. And one more thing I like to mention about the glove is that it actually has lycra panels. So not only is it breathable, the palm is all open to air, but it also allows for expansion of the fabrics, so it can accommodate a lot more, or a lot different, or variations in people's hands. You might have wider fingers and shorter fingers. This comes in various sizes, and you, when we take them, or when we ask for measurement, we specify it to you and put the combination of the splint and the glove together to customize it for you. And then the last thing that's very important about the SaeboGlove is the actual tensioners. These black, what some people call the rubber bands. All right, that is what helps you extend your fingers when you're wearing the SaeboGlove. You can see here, there are little black hooks that are sewn in all over on every joint of your finger. So if I roll back here, look, here's a joint, here's a joint, here's a joint. Guess what? We have hooks. Here's a joint, here's a joint, here's a joint. So you can customize these rubber bands to help with every joint of your hand. And this is what the tensioners actually look like. They come in a case like this with 5 different sizes. And if you actually flip the black case over, we put a diagram that suggests for which one of these little hook systems, or which one of these joints you want to use, but it does not mean that you have to use it. And there's some tips and tricks that we have online that on our YouTube page that you can watch, but also it allows for, again, that variation of people with different hands to use the same glove. Now, I told you earlier that I was going to talk about a home exercise program. This, when you put it on, it allows your hand to then grasp and release, right? It essentially pulls your fingers open, helping you release objects. So a home exercise program, unfortunately, is not a very strong area that rehab follows up on. And this is a great thing to help you excel at your home exercise program. Because if you're in outpatient therapy and you're only being seen once, twice, maybe 3 times a week, what are you doing on all the 100 and other hours of the week? That's supposed to be your home exercise program. That is the dedication and the time that you need to put in to make your efforts in therapy and outside of therapy positive, so you can continue on the road to your recovery and where you want to be. So when you put the SaeboGlove on, you're now able to do things like grab. These are little 1-inch fine motor cubes that we actually include with the SaeboGlove. Allows you to pick up small objects, allows you to pick up larger objects, and you want to challenge yourself. So when you go and meet your clinician, whether it's an OT or a PT, you want to have them challenge you and modify your home exercise program so that you're working pretty hard. If your exercises are super easy and you don't feel like they're doing anything, they probably really aren't. And you need to change your program and improve it and challenge your body, because the more that you challenge your body, especially now that you can grasp and release wearing the SaeboGlove, that's how you're going to get the recovery that you want. Also, let's say that you're fatiguing or you're early in your recovery. I've had several clients that opt not to go to a skilled nursing facility and they go home to home health because they have a good support system. You know, they have sons and daughters or grandkids or spouses, family members, caregivers, all of that at home. Well, if you're at home and you've got a home exercise program set up, you can combine this with electrical stimulation to help increase the flexion that you need to grasp something firmly, or you can put these pads on the backside of your arm and help you extend your fingers more if for some reason the glove does not have enough tension to open your hand. Now, don't forget that if you have, this is for people with mild spasticity or tone, down to people who have no movement or no ability to open their hand volitionally or on their own. This is not meant for someone who walks or who unfortunately, as they walk or cough or sneeze or anything, their hands in a clenched position. We consider that moderate or severe spasticity, and this won't help you at this time. However, what I talked about earlier, that Saebo Flex device, that one will help you. It's built to be strong enough and have enough tension to resist that spasticity and help you on your way to grasp and release. And then once you find that you can grasp and release and you don't have as much tone, then you can switch into the SaeboGlove. So this is again, if you think about back to that circle of all of our products, we have stepping stones and devices for every part of your recovery, from acute, right in the hospital, all the way to decades past your injury. So to better explain this, I want to give you some video examples. And earlier I listed a bunch of diagnoses like radial nerve palsy, brachial plexus, Guillain-Barré, multiple sclerosis, stroke, etc. So here are a few videos showing you what some of our former clients look like and then what they look like right after they put the glove on. That's why we know that this is a life-changing product. So here's someone with radial nerve palsy. So the radial nerve is one of the big nerves on your, or in your arm, that controls sort of the thumb area and the pointer finger area of your hand. Now look at this, same guy, same shirt, same place. 10 minutes later, right? You can see this. Really big trouble trying to open up his fingers, can't pry it, can't get a hold of it. And then here we go. Grasp and release. Boom. Doesn't that look great? That is functional training right there. And all he did was put on the glove and then start working with it. Here's another example. This is the same gentleman lifting his hand up, trying to open a cupboard. Because again, if you want to be functional and independent, you have to do these things. There you go. First time wearing the SaeboGlove, and he was able to easily open that cabinet. And then with his unaffected side, he could reach into the cabinet and grab whatever he wants. Here's a stroke recovery. If you look on the left, there's very minimal finger movement. The person can close their hand. There you go. That's a nice strong close, and partially open their hand. Now watch it. Easily opens the hand using those tensioners to work on the joints of the hand and the fingers. And now he's being assisted with control of his arm and overcoming the weight of his arm, you know, let's say 8-10 pounds, but he's able to grasp and release. There you go. Pick it up, put it down. We're not doing anything. That is him or her. And then here is an incomplete spinal cord injury survivor. This gentleman can close his hand, but has trouble opening the hand. Here's an example of oh shoot, I don't remember what that's even called because I stopped using them. But it's essentially Velcro wrapped around that, and it's for working fine motor and the motors or the muscles of the hand. And there's that same person. Look how easily they can open and close their hand because the splint holds them in a proper wrist position, and then the tensioners help him open his hand. Look at that, just pushing it right along. So I told you I wouldn't bore you, but I always like to mention the research because I've got my doctorate in occupational therapy. And I did a quick search today just to see how many were out there. And on one website, I stopped there just because I was floored by how many research articles are out there. There's 50 plus articles on Google Scholar that actually are testing the SaeboGlove or have used it in their tests. And all of the research that was used by the co-founder Henry Hoffman in designing this amazing product is based on decades of research. Like, we have been studying how the human body for hundreds or for centuries, and there's tons of research about putting the hand in the right placement and how to get the hand to functionally move. Well, guess what? He used all that research and designed something that allows a person to grasp and release, hold their wrist in the right position, and return to function and independence. And one of the best things, I'm a member of our national OT association, the American Occupational Therapy Association. I actually found that there is a 2019 article, so a very, very recent one from this year, where the AOTA concluded, or at least they published this research. The researchers concluded that the SaeboGlove may improve engagement in both occupations and improved upper extremity function with individuals with incomplete SCI. And there's other research out there that says it for stroke. There's other research out there for radial palsy and brachial nerve plexus injuries and other types of palsies, orthopedic injuries. There's a few of them that talk about tendon repair and use. So don't limit your mind, and don't think that you might not be right for using this device, because it incorporates or it encompasses a lot of people in the ability to recover by putting the hand and the wrist in the right position and then using those tensioners to help them open their hand and return to being functional. So I want to remind everyone that in the US, we allow any clinic to demo any of our patient products or any of our clinical products that were listed previously, as well as I forgot to mention earlier that I think on your phone and if you are on your computer, I put two handouts on here. One is the printable PDF of this presentation, but also I put the Saebo Solutions flyer, the slide that I showed you with the circle of all of our products. I put both of those for you to download for more information. You can go to our website and get more information. You can call us at our toll-free number. You can contact us on Facebook. There's many different ways, but if you're interested, we allow you, every clinician and clinic, to test out things for at least 2 weeks, as well as for clients in the US, we allow you a 30-day free trial. I'm sorry, for our international partners, you'll have to go to our web page and click on our menu at the top that shows our international partners, and then contact them, and we'll be able, or we can help you contact them, and we'll be able to figure out if you can test trial some of these or not. It just depends on where you are in the world. But here in the US, we allow patients and clients to use our patient products for 30 days. You get to try it out, you get to wear it. We don't make you leave it in the plastic. We want you to wear it and use it and figure out if it's right for you. Because thinking as a clinician, we do not want to do you wrong. We want to help you. So what I just want to let you know that it is a 30-day money-back guarantee, and you can return the device after using it, getting it dirty, whatever, but most of the time that does not occur. People find that once you are able to use it and test it, that it is the right fit for you. And we have wonderful customer service and patient representatives that will help you sort of troubleshoot which device might be the best for you, or suggest ones that might accompany yours for an even better recovery, whether if you want to use it just in rehab. I always encourage that you use it at home for your home exercise program, because the more that you do, the better it's going to be. Your recovery, at least, that is. And then I'd also like to mention that next month's webinar is going to be on our flagship product, the Saebo Flex. And the Saebo Flex webinar is going to be on December 18th, 2019. That is a Wednesday, and it's going to be at 2 p.m. Eastern time, probably last for about 30 minutes. And the Saebo Flex, again, is designed for grasp and release training for people with moderate to severe spasticity. And it has been successfully used by several clients that are decades past their initial injury or ailment onset, their diagnosis. And I mean, there was even one gentleman that they wrote a research paper about that was 23 years post-stroke and started using the Saebo Flex day one. So his hand hadn't worked for over 20 years. And we put that on him, and he started grasping and releasing and training. And 2 years later, he was flipping coins. There's actually videos of him on our YouTube page, but he's flipping coins and picking up money and being extremely functional and participative in life. And I wanted to announce this because it is an amazing honor. On November 16th, this past week, the Saebo Flex was placed in a 25-year museum exhibit in the Science Museum of London. It is located in their Wellcome Galleries, which is the world's largest medical exhibit. And the Saebo Flex helps celebrate 500 plus years of breakthrough medical treatment interventions. And the honor is not only being in the museum, but that the Saebo Flex is recognized as one of the largest innovations in the history of medicine. What an honor, and we thank the Science Museum of London for that honor. And if you look on our Facebook page, we have photos of the co-founder and several of our UK representatives over at that, pictures of the exhibit and how it's displayed and videos, and you can continue to look for that because we're going to be celebrating that wonderful accomplishment. And I'd like to applaud Henry Hoffman and his brother for developing this 15 years ago and changing tens of thousands of people's lives by inventing this product. So I want to thank you for coming out today and listening to me, and I'm going to open the floor for any questions that you may have. If you're on your phone, there is a question box at the bottom that you can click on and type a question. And then also, if you're on your desktop or a handheld device, you can, if you have the little display panel on the right side, there is an area labeled questions where you can click on that and put in a question for me. So let's see what some of these questions are. So one, if there are other people interested in becoming a distributor or an agent around the world, you can just contact us. In fact, why don't you, if you're interested, you can go to our website and start using, contact one of our representatives with the chat feature that we have, or you can call our toll-free number, or you could also write an email to clinicalsupport@saebo.com, and Saebo is S-A-E-B-O, and that'll allow you to, we can redirect you from our clinical support to the right person. All right, that was actually the only question was about becoming a distributor. Are there any other questions out there? Unfortunately, I can't undo the microphones for everybody because it probably get pretty annoying. I have somebody who is asking about if it's available in India. And to answer that question, if you go to our website, we have at the very top, our menu, we have something called Global Partners, and you can click on that, and it has a map of where everybody is. And then if you fill out the form, we can connect you with the person in your local area, and you can figure it out. We're in 50+ countries around the world and growing quickly. In fact, I think our fastest area is sort of Southeast Asia at the moment. But more and more people are supporting us. More and more people are realizing what wonderful products we create at such a low price point, especially in the medical realm, where there's things that are hundreds of thousands of dollars, and we don't have anything near that. Not even on that same spectrum. So that's what I love. We create really, really high-end durable products, but put the price point where everybody can purchase them. And if you're having financial issues too, we can possibly figure out a way to help you with a payment plan or some other way of getting you that device. But if you just contact us, we can help answer those questions. Also, there's a question about our things available for the kiddos. And kiddos, I mean kids. We have a lot of children's products, not as many as adult, but we do have pediatric products. And if you go to our website, we can either contact us or go to our website. You can see all the different pediatric products. Let's see. Now we got a bunch of questions coming in. How about, will using the SaeboFlex help reduce my tone? That's a great question. To quote the co-founder, Henry, and the designer of the SaeboFlex, once you use the SaeboFlex, the hand is like butter. And it's amazing what happens because that hand is clenched. And when you put it in the SaeboFlex, it opens your hand up, allowing those muscles to relax. And then when you start to grasp and release, it even relaxes more. It goes along one of the theories that if you contract and relax your muscles, it's going to lengthen. It helps lengthen and stretch out your hand and reduce the spasticity. But of course, you don't put it on and then just all of a sudden you have no spasticity. You have to work at it. Because unfortunately, recovery is all about the work. There's no magic pill, but that's why I love my job. I try to help everybody as much as I can as a clinician, as well as support and motivate people. And we have even a stroke survivor website, Facebook group, where you can go and follow other people recovering from stroke and neurological injuries on their road to recovery. I was looking this morning and there was a gentleman that was in the weight room doing like hanging from a bar and raising his legs up and pushing up several hundred pounds with his legs following a stroke. Great, amazing, motivating type information. Let's see, what's another one? I am Saebo-trained for the Flex, but would like to try the glove. I'm in Calgary, Canada. Is this possible? Yes, actually, we have a few Canadian distributors. And like I said, if you go to our website, there's a Global Partners little menu item at the top of the screen on our red menu, and you can click on there and enter your information, and then we can help you from there. Or you can contact our representatives Monday through Friday, 9 a.m. to 5 p.m. Eastern Standard Time via our toll-free number, email, or Facebook, or we have one of those live chat features on our website as well. Another question. would this be appropriate for someone who is recovering from a stroke, has some movement in the hand, and is told to strengthen the hand? Or would there be a different product that is better? No. So if you're, hopefully you caught the whole webinar, but at the very beginning I said, what are some of the benefits of using the SaeboGlove? And it is for range of motion. So it puts your hand in the right position and helps you, by using your hand, reduce tone and increase the flexibility and length of your tendons by helping you extend your hand into the right optimal position for being functional with almost every task, as well as allows you to strengthen your hand, because when you squeeze your hand, you're going against the tension of the that is produced by the individual tensioners. So it's essentially a resistance training, but also if you think about it, the more that you use your hand, the stronger you're going to get, both in the extension of your fingers and in the flexion of your fingers, because you're using them, and you can train your hand. And like I said before, it was customizable. The SaeboGlove's customizable. So as you progress and you strengthen, you can take off some of the tensioners and then make it even harder and challenge yourself, because challenging yourself and making your body adapt to those challenges is exactly how you get better and stronger. Brandon, if you're still on here, I see your question. If you just contact one of our representatives, they can answer that for you. I can't tell you about what all the prices are around the world, but that's why we can put you in contact with the distributors, and it changes for every place in the world. Here's another question. For someone who has not been able to extend the fingers for more than 2 years, is it possible to make them flex with the SaeboGlove? So this actually has extension and flexion. So what we usually look for in the criteria for the SaeboGlove is that you have a little bit of the ability to flex your fingers, but it really assists you in the extending your fingers. And if you remember, I showed a picture back about a home exercise program. Let's see if I can get back there real quick. There. If you have this picture, you can see that the gentleman is using electrical stimulation along with this product, helping him flex his fingers. And it's part, the way that we use electrical stimulation is we essentially excite the muscles and sort of get them firing like they're supposed to. But eventually what you're going to do through training is you're going to find that you can use less and less electrical stimulation, and you're going to take over volitionally, which is what it's all about, being independent. All right. And then one more question. Yeah, it's a question about the Saebo's using eStim with it. And yes, it is a great accompaniment with it. If you don't know how to use electrical stimulation, we have videos that show you that, as well as we always recommend that you have someone in your support group outside of your family and caregivers. You want to have somebody, a medical professional like a physiatrist, a neurologist, and especially rehab professionals helping you on your road to recovery. It doesn't mean you have to go to rehab for months and years on end, but you want to have that clinical advice, and they can help you learn how to use eStim. All right, everyone, I really appreciate it. Thank you for coming out for this webinar. And if you have any more questions, you can reply to the survey that you'll probably get about this webinar and that email account, or contact us at, again, Facebook, at our website, using our chat feature, calling the toll-free number, or you can contact us at clinicalsupport@saebo.com. I wish you all well and a swift recovery, and or great help with your clients if you're a clinician on this call. Have a wonderful day, and I look forward to having some of you on our webinar next month. Have a wonderful day.